Every lady is unique in her own way. Likewise, their experiences with pregnancy differ greatly. Not every woman experiences the same symptoms, and not even all women experience the same symptoms during each pregnancy. It is possible that you will not recognize that you are pregnant in the early stages of the pregnancy because the symptoms of pregnancy often coincide with the symptoms that you may feel immediately prior to and during your period. The following is a summary of some of the most frequent early pregnancy symptoms, starting with the first sign of nausea. You should be aware that these symptoms can be brought on by a variety of different conditions in addition to pregnancy. Here we will discuss signs and symptoms of pregnancy. The video is going to be very interesting, so make sure you stick till the end. Before we continue to our video, make sure to smash the like button, subscribe to our channel, and hit the bell icon to never miss any of our future uploads. Now let's get started. Number 5. Breast changes. Another extremely early indication of pregnancy is breast changes. After conception, a woman's hormone levels rapidly alter. After a week or two, the alterations may cause their breasts to swell, hurt, or tingle. Alternatively, they could feel heavier, fuller, or softer to the touch. Additionally, the areola, the region around the nipples, may get darker. Breast alterations could result from other factors. But bear in mind that it will take a few weeks for your body to adjust to the new hormone levels if the changes are an early sign of pregnancy. But when it does, breast discomfort ought to subside. Number 4. Nausea, morning sickness. One well-known pregnancy symptom is morning sickness. However, not all expectant mothers receive it. Although the precise origin of morning sickness is unknown, pregnant hormones probably have a role in this symptom. Though it can happen at any time of day, morning sickness is the most prevalent during pregnancy. Additionally, some women find that specific foods make them crave them or make them sick. That and hormonal changes are connected. Even the mere mention of a formerly favorite cuisine might make a pregnant lady queasy due to the effect. The sickness, cravings, and dietary aversions may persist the whole of the pregnancy. Fortunately, many pregnant women experience a decrease in their symptoms around the 13th or 14th week. Eat healthily in the meantime to ensure that you and your developing child receive vital nutrients. To get advice on it, you can speak with your doctor. Number 3. Fatigue. Beginning in the early stages of pregnancy, it is common to experience extreme fatigue. As early as 1 week after becoming pregnant, a woman may begin to experience unusual levels of exhaustion. Why? It is commonly associated with having a high amount of a hormone known as progesterone. However, other factors, including reduced levels of blood sugar and blood pressure, as well as an increase in the formation of blood, can all be contributors. If you are experiencing exhaustion during your pregnancy, it is imperative that you get plenty of rest. Consuming foods that are high in iron and protein can assist to counteract this effect. Number 2. Spotting and cramping. The fertilized egg adheres to the uterine wall after fertilization. Spotting and, occasionally, cramps are some of the earliest symptoms of pregnancy that might result from this. It's referred to as implantation hemorrhage. 6 to 12 days after the egg is fertilized, it happens. Some women mistake the blood and the cramps for the beginning of their period since they resemble menstrual cramps. However, the blood and cramping are barely noticeable. In addition to bleeding, a woman might experience a white, milky discharge. That is associated with the vaginal wall thickening, which begins practically soon after fertilization. The discharge is brought on by the vaginal lining cells growing more quickly. Usually safe and not requiring treatment, this discharge can persist throughout pregnancy. However, let your doctor know if there's a terrible smell associated with the discharge or if you experience burning and itching so they can determine whether you have a yeast infection, bacterial infection, or STD. Number 1. Missed period. A woman's missed menstruation is the most evident early sign of pregnancy, and it is also the one that causes the majority of women to get a pregnancy test. Case in point, however, pregnancy is not the only possible explanation for a missed or delayed period. Additionally, some women bleed more than others during their pregnancies. If you are pregnant, you should consult your physician regarding any bleeding concerns you may have. For instance, when is normal bleeding and when is it a hint that something more serious is going on? Absence of a period can be caused by a variety of factors in addition to pregnancy. It's possible that you've put on too much or too little weight recently. There are also the chances of hormonal imbalances, exhaustion, or stress. When they stop using birth control pills, some women don't get their period for a while. However, if your period is late and you think you could be pregnant, you should get a pregnancy test as soon as possible. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. Thanks for watching and have a wonderful day.